And now it's Boomer Life. Lifestyle ideas designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation. This is Boomer Life.
Good morning. Welcome to Boomer Life live on AM 650 radio. This is Tom Lucas. Boomer Life is a celebration of the baby boomer lifestyle. A couple of boomers in the studio, yours truly and Dr. Ron Zokol. You're one of the better known baby boomers in town.
Definitely a baby boomer.
Now, on the last show, Ron, you weren't here. Where were you?
Oh, somewhere between Venice and Rome along a cruise ship, I think.
It's all pleasure, of course.
No.
No, you were actually you were giving
Yes, lectured
seminar
in Venice. I was also lecturing on the cruise ship, and I had a lecture engagement in Rome.
To a bunch of other dentists, or
Yes.
who was on the boat?
Yes. There were dentists on the boat. There were dentists in Venice, and there were more dentists in Rome.
Wow. I'm thinking maybe next time you do this, do you have another one planned?
Not for the immediate future.
Darn, because I was thinking that maybe you could have an MC come along with you just to help out a wee bit.
I'm sure we can find some way to make that happen.
All right. Let's talk about BC Perio, shall we? I mean, that's why you're here, and you've made the move. You've moved from your former office on, is it Canby?
Canby and 12th Avenue. Yes.
Over to Broadway?
Yeah, 15 years there, and we're now at BC Perio.
How are you liking it?
Enjoying it very much. I spent 20 years in practice with my father, my first 20 years in practice, and the next 20 years were completely by myself. And now I'm practicing with four specialists, four of them, all four are periodontists. Bobby Birdie is a prosthodontist as well as a periodontist, and I have the rare privilege of spending the rest of my career probably working with these boys.
I should put you on the spot here. Do you know all the other dentists' names?
I do.
What are they?
Okay. You have Dr. Tim Gould, you have Dr. Josh Kleinman, you got Dr. Peter Munns, and of course our principal in the business is Dr. Bobby Birdie.
Now, see, the reason why I asked you, Ron, is because when you go back to work on Monday and these guys are listening to the show and they didn't hear their names, they're going to be a little hacked off. You know what I mean? So we got to keep them happy. People come to see you because, number one, they have problems in their mouth.
That's correct.
But number two, what you do is you make their teeth look nice and healthy, but you also give them a brand new look on life, a new lifestyle.
Yeah, and it's all about finding out what's important to them and see if we can help make their life better.
What are some of the problems people come to see you about?
Usually it's either disease related or deterioration related to excessive function and breakdown, missing teeth, things like that. There's a lot of things that can be done by an average dentist and fillings and such, but when it comes to advanced work where things start to go awry or have been going awry for quite some time, now the case becomes a lot more complex, and that's where I fit in.
And if people go to the regular dentist regularly, they don't necessarily need to have a referral to come to your office, do they?
No, absolutely not. Although we will work if you already have a dentist and you choose to come to us, and we come in and evaluate, see where you're at, understand what your desires are and your priorities are. We will work with your dentist as well to make sure that you get the very best of service.
Now, people have probably heard you on the radio for years in this city. They've also heard Dr. Bobby Birdie, and they think, you know what, this sounds kind of interesting. I would like to go and see these gentlemen, but gee whiz, what's the consultation going to cost?
Nothing.
Really? Nothing?
Well, normally speaking, depending on what you require in terms of x-rays, now, one of the things we do is we provide a panoramic radiograph for no charge.
Nice.
I mean, this is in almost all other situations, that's about a $375 bill. Our choice to do this is based on the principle that the CT scan gives us the complete information that we know to properly analyze exactly what's happening and to treat and plan a solution. We didn't want anything to be in the way of doing it right and doing it properly.
So compared to the x-ray you get in the regular dentist's office, this is day and night.
Well, very much so. These machines are not cheap, and most dentists can't afford to get one, so they have to send people out to a facility that does this for other dentists. So when a facility such as BC Perio invests hundreds of thousands of dollars in technology and provides it for no charge on a first visit, that's a statement, I'd say.
Pretty good deal.
I think so.
The thing I like, too, about your office, other than the great staff you have down there and the great view, fantastic coffee, but what you can do is after you've seen someone, you've done your consultation, you can actually tell them that very same day what they're going to need to have done and what it's going to cost.
That's the whole idea of this thing. And if you think about what happens when people unfortunately cannot afford to invest in a CT scanner directly in their office, they send you to another facility. You have to make an appointment to do that. Then you go to that appointment to get it done. Then they have to process the image and get the data back to the dentist, and the dentist then has to look at it, and then you point in again to meet with a patient to analyze that. We can do this in 10, 15 minutes.
Wow. That's pretty exciting.
Oh, yes. It's excellent service.
Last time I was in your office, I was, again, watching the soccer matches are on the giant screen TV out there in the waiting room, having a nice cup of coffee, and a gentleman came up. He's a patient. I don't know who he was, but he was talking to one of your receptionists, and he said that he likes to cook. And he said, now, thanks to you and Dr. Bobby Birdie and the other dentist there, he says, I can now taste his food.
Yes.
Jeez.
Well, you think when people wear plastic in their mouths, you cover up an awful lot of the taste buds. And you always think it's just on your tongue. That's not true.
Mm-hmm.
But when you wear plastic in your mouth, you're diminishing your taste potential. When that comes out and you have implant-supported teeth, all of a sudden, all those extra taste buds fill the gaps, and you start to enjoy your food more. You start to enjoy, let's say, wine. We splash wine all over our mouth to get the benefit of the beautiful flavors. Well, now it's there for you.
That's interesting. That's interesting. So if people have been wearing plastic in their mouth, maybe it's time to think about getting rid of that.
Usually a very good idea.
I've heard stories. I don't have a plate or anything, but I've heard stories of people that do have plates that eat things with seeds in them. It's not a good thing because the seeds can get underneath, right?
That hurts.
Yeah.
That hurts a lot. Yeah. It's one very, very good reason that people actually move out. And the bone changes underneath. These things don't stay fitting. Even though they're fit to your mouth, they don't stay that way. So what happens is the bone deteriorates and it changes shape. Now these hard plastic things that used to fit decently in your mouth no longer do. Now you have open spots, food gets in, you press on the gum tissue because most of these things are supported by gum tissue. And when you have something between the denture and the gum tissue, you bite down, it hurts the gums like crazy. Well, if you don't change that, then it causes the problem to be even worse.
If somebody does have bone deterioration, I understand you can take care of that in your office as well.
That's our skill set.
Wow. So that's way different than the regular dentist.
Absolutely.
And sinus lifts, that sort of thing too?
Sure.
Why would somebody have to have a sinus lift?
Well, you think about the head has about 7 different sinus compartments within it, and I don't think anybody understands why this has ever happened. But the maxillary sinus, there's frontal sinus, ethmoid sinus, sphenoid sinus, all of these things. The maxillary sinus is the sinus in the upper jaw that is top of the roots of your upper back teeth. And when those back teeth are lost, that sinus expands to eat out that jawbone in that area. Well, it doesn't leave you any bone to put teeth back on implants. You got to put the implants on. But we know what we do actually is we move it back. We move the sinus up and let the body regrow that bone so we have enough bone for implants. So that only takes about a 5-month period.
Could somebody be in need of a sinus lift without even knowing it?
Oh, absolutely. There's no evidence. There's no pain associated with the expansion.
And you can breathe normally?
And you can breathe normally. Everything seems normal to all people, and this is normal for people. So when somebody comes in, they've been missing upper back teeth for a long time, and they don't need a sinus lift to help them get longer implants in, it's very unusual. This is the norm. It is not the exception.
Interesting. You said the magic word implants, and I want to talk to you about implants. What, number one, is an implant for somebody who's maybe never heard of an implant before?
An implant is usually a titanium structure that replaces the root of a missing tooth. And when you put that into the bone grabs it like crazy because the body doesn't see titanium as a foreign material. It has absolutely no reaction to titanium. So the bone actually grows to the titanium and grabs onto it so that it becomes very rigid in the bone and now can support a tooth that you can bite on.
So you end up having a mouth kind of like Superman.
In the weirdest configuration, it's more like Jaws, and on the Thunderball and the James Bond movie, all metal. That's not what we want to look at. That's definitely not. But we can build the metal structures within the jawbone to house teeth that look like natural teeth. So nobody outside would be able to see the difference.
I'm glad you said that, natural teeth, because I think that's basically what somebody wants. You don't want the you said before. Also, you said plastic in your mouth, and a lot of these dentures, God love people who wear them, but they look like dentures. They look like plastic.
It's an art form to do a denture well. It really is.
I'll bet.
Yeah.
Yeah. So if somebody's interested in wanting to come and talk to you, put you on the spot. I know you've been away there in Rome and Paris and God knows where else, but what are your offices? You have 2 locations now.
We do. One is at 777 West Broadway in Vancouver, and the other is in Coquitlam.
Interesting. And do you know the phone numbers off by heart?
No, I don't.
That's okay. They can look it up on your website. Is it BC Perio?
bcperio.ca.
bcperio.ca. Perio is spelled Perio. boomerlife.ca. And your telephone number is in Vancouver, 604-259-1108, 604-259-1108. And in the Coquitlam office, you're on Johnson Street.
That's correct.
The telephone number there is 778-635-9157.
I'll remember that.
I've been to the eye doctor, so I can see that now. 778. What is that? 653-9157 in Coquitlam in Vancouver. 604-259-1108. Brand new office, state-of-the-art facility.
Oh, incredible. Incredible.
Kind of gives you a new lease on life going to work every day.
Well, it's very, very different. Being your own boss for a lot of years, and you walk in, and now you're merging with other practitioners who you have a great amount of respect for, and you collaborate. And that's another level again when it comes to working together, and you can share principles, ideas, philosophy, knowledge. Your service quality takes another jump up.
Now, Dr. Bobby Birdie, God love him, he's kind of a young guy, but he certainly knows his stuff.
He does. He's one of the most credentialed individuals you'll see in North America. I always say good judgment is what we offer. and good judgment takes two things. It takes knowledge and it takes experience. He has all of that knowledge, and he's got a wealth of experience as well.
Last time when I was in your office, I noticed there was another doctor came through. I think he's from Edmonton, and he was looking around your office. You get a lot of that?
Yeah, all the time. We have doctors coming through all the time who want to see how was this thing set up, because it's beautiful. The technology is spectacular. It's first class, state of the art. It's all the components are right there.
How long was this in the planning? Because you just don't throw an office like that together just in a couple of minutes.
If I were to put myself in Dr. Birdie's shoes here, I would say it's probably been in his mind quite some time as to how he's doing it. But the actual planning process takes less than a year to put it all together.
Really?
You have a lot of people who help you. Professionals who know how to lay out an office and set it up. So the plans, drawing up the plans, you pretty much tell them what you want to accomplish. You find the space you're looking for, you lay it out, and you start to tweak it. And you say, I need this, I need this, I need this, and so on and so forth. And Bobby hasn't left anything out.
Well, your equipment is certainly to die for.
Yeah, very much so.
It's just state of the art. It's beautiful stuff. And the thing I like too is you can sit in the chair, you lay back, the dentist climbs into your mouth, and you watch television. It's pretty cool. Let's talk a little bit more about implants in just a second. We're listening to Boomer Life. It's Tom Lucas and Dr. Ron Zokol. Our telephone number, by the way, if you have any questions for the good doctor, he's in. It's free advice, and you can't beat that. 604-280-0650, 604-280-0650. Maybe you're thinking about getting implants. You want to know a little bit more about them. Are they for me? Maybe they're not. Maybe they are. We can find out. Please give us a call. And if you're out of the local dialing area, it's a toll-free call, by the way, 1-877-280-0650. That's 1-877-280-0650. Or in town, 604-280-0650. Dr. Ron Zokol and yours truly, Tom Lucas, return in just a moment.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on AM 650.
They say there's no place like home, and isn't that the truth? In fact, that's what Shannon Oaks is all about. It's a place that's built on more than a welcome mat. It's built with love. Shannon Oaks is an all-inclusive, premier independent retirement living home. They realize that you don't need care, but maybe some support might be nice. It's still completely independent, just like you're living now. Open to singles and couples. Part of Baptist Housing. Book your tour today. Learn more online at baptisthousing.org.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
Missing teeth? Don't want dentures anymore? Not happy with the way your smile looks? Dr. Ron Zokol can help. As an internationally recognized authority in oral implantology, Dr. Zokol is dedicated to all your dental care needs and can help solve your dental problems and help you achieve optimum oral health. Book your free consultation or learn more at drzokol.com. That's DRZOKOL.com.
AM 650.
Keep smiling.
Keep smiling. Keep smiling.
Keep smiling. Keep smiling.
Keep smiling. Keep smiling.
keep smiling.
Mm-hmm.
Yeah, well, I know you're smiling, Dr. Ron, because you just got back off a fantastic trip.
Yes, indeed.
And now you're back to work, and you have to make other people smile, too.
Yep.
That's what it's all about.
I love doing it, too.
Lifestyle is very important. People come in. And it's summertime, too. Let's think about this. Summertime, and the living is easy. People had to go out in the backyard and have barbecues.
They do?
They have maybe... I had some great barbecued corn on the cob. You ever had barbecued corn on the cob?
Indeed, I have.
Oh, gee. Well, guess what? People with those plastic teeth may not enjoy it as much as you and I do.
I don't think there's any question about that. Some in case they can't even eat that stuff.
Oh, geez. There's something we can do about that?
Oh, is there ever?
Really?
We got that one in the bag.
I'll bet you do. We have a person on the line from Maple Ridge. Her name is Heather. Heather, good morning.
Hi, how are you? I hope you can hear me. I'm on my way to the dentist. So
You
I hope
are?
can hear me clearly.
Well, how timely. Are you looking for some advice before you get there?
Timely. I may have to turn around.
Well, maybe not. Maybe not. Are you in the car right now?
Yes, I am.
Are you driving?
I have a Bluetooth.
Good.
Oh, isn't there a cure for that, doctor? Bluetooth?
The one in my ear.
Oh, sorry.
No.
Oh, well, but that's a different doctor.
We don't want to make that one white. No.
So, Heather, you have a question for Dr. Ron Zokol?
Yeah, a couple. I've been researching somewhat the option. I broke two back teeth, lower back teeth at Easter with hard candy because it was very clever. And so now I'm looking at my options for, I had to get the two teeth pulled. So obviously I need something there, and that's hence why I'm going to get some options. So a couple of phone calls I've made to dentists, I've gotten kind of diverse price ranges on them, and I was kind of wondering about that. If it's not kind of a standardized cost with dentists, or is it something that dentists can kind of parlay a price kind of based on location or difficulty of the job, or unlike cavities, it seems to be kind of a straightforward price.
This is something that's incredibly difficult, Heather, to give you a complete answer for you personally. But in general terms, what we do is that we have to look at what your specific situation is. We have to see what level of disease might be present and what assets you have. Well, the assets are nothing to do with money, has everything to do with bone structure, quality of gum tissue, and determine what can we do that fits your goals and your priorities. So if you feel that if you're going for something like a complete tooth removal and implant-supported teeth, there is a more regular protocol. Now, if you go to 5 different dentists, you might get 5 different solutions.
Right.
However, and that's the problem, is that who do you know and how to trust what you get? Because the dentist is kind of a dentist as far as everybody's concerned, and that's a problem, I think, for the layperson and such. So I think it's a good idea to probably go to 1, 2, or even 3 places and hear what's being said.
Right.
And
I
see
think
what happens.
the cost for me for the implants alone were the concern that there seemed to be a diverse range of costs, not with the removal of teeth or a plate or something else, but just with the cost of the implants. I'm just wondering if that was normal. You get a quote for, say, $3,000 or $4,000 or $5,000, or if there's a standard cost for them as a rule.
As a rule, Heather, the implants usually are somewhere in the let's say $2,000 range for the implant. So when somebody quotes you 4 or 5, it's probably because they're doing some bone grafting and doing extra work on top of it. Now, they may term it as being an implant, and they've combined all kinds of different things. Now, if one dentist says, well, gosh, I can put a small little implant in that area, I'll just charge you $2,000, and somebody else says a small little implant's not going to work very well for the long term. If we don't grow bone, you're only going to have that thing for a few years before it causes you problems. If that's the case, then your $2,000 expense is going to be very poor.
Short-lived.
You
very
bet.
Short-lived.
So the goal is to get something for the best value, the best price that will last the longest.
Oh, very good. Thank you. And one more question, if I may. I was just when I noticed that with my dentist, my former dentist, now I've moved, and a few other offices, Botox is now becoming a service that's being provided in dental offices. Are you providing that as well?
Yeah, we do.
Yeah. Oh, I just love it.
Hold it. Where did you want the Botox? Heather?
I'm quite vain, so I mean, I have to get the cheap thing done, but I thought, yeah, I think it's a good idea because of the the education that dentists have about all the muscles in the face. I think it's
Yes.
brilliant, quite frankly. So I was just wondering if you did that as well.
No, I trained on that a long time ago.
You know what you should listen. You're on your way to the dentist, Heather. Here's what you do when you go to your dentist. See what he's got to say, he or she. Come back home. Do you have a computer? Can you get online?
Oh yes, absolutely. And I'll be back in the Coquitlam area, and I know you have an office there, which is great.
Absolutely. So now, what's your website again, Doctor?
It's www.bcperio.ca.
All right. I wrote it down even while you said it.
While you're driving, you're multitasking.
I'm a multitask.
All right, that was bcperio, perio.ca.
That's correct.
So Heather, what I suggest you do is go see what your dentist has to say, as Dr. Ron just said, and then maybe give Dr. Ron a call Monday and chat with him, and then maybe go down and see him.
Oh, that's perfect. Thank you so much for the information.
Good luck with that, Heather.
And as we say, for God's sake, don't do anything today, okay? Because it's Saturday. You never want to get a tooth filled on Saturday. That's one. Heather, you're a good sport. Thank you for calling.
Stay safe on the road.
Yes, be safe. Thank you very much. If you want to talk to Dr. Ron Zokol, our telephone number is 604-280-0650, 604-280-0650 if you're in Metro Vancouver. And if you're out of town, it's a toll-free call, and that number is 1-877-280-0650, 1-877-280-0650. We've had you on the show for many, many, many times. We've also had Dr. Birdie on the show. We talk about teeth in a day. What the heck is teeth in a day?
That is when you put an implant in and you put a teeth on your implants the very same day. So, for example, somebody comes in, their mouth is really full of terrible teeth, and the disease is so much you can't save them, you're going to take them out. We can actually bring you in, put the implants in, and give you a full set of teeth that very same day.
Wow, that is exciting.
Yeah, and the technology helps make that really realistic and very predictable.
So what do they just sort of clamp on, or to the teeth you have, or other teeth there? Or
No. We take all the teeth out, put the implants in, and then put the solid teeth in place. No, yeah. It's really a spectacular service, so people don't have to go without their teeth at all.
No wonder people come out of your office feeling so happy.
Well, we've had people with tears in their eyes, as they come out and they take a look at themselves and they feel the solid teeth in their mouth, and some people just break right down. They're so pleased and happy with the result.
Well, as I told you before, and you always manage to seem to be away whenever I come down for my visits, but I like to hang out in your office. Number one, to drink the coffee because it's free and it's good. But number two, I like to look at the people in the waiting rooms, the people coming out from seeing the doctors, and they're all really happy.
Well, we like it that way.
I wasn't sure they're happy because it's the work you're doing or the drugs you're giving them, but one or the other, if it's a combination of two, it's a great combination. We're just kidding. You're in good hands when you go down there. It's 29 minutes after 11 o'clock. Let's go back to the phone line. Lance from Vancouver is on the phone. Good morning, Lance.
Yes, hello, Doctor. A few years ago, when I was chewing my food, a tooth cracked. And, the tooth had to be replaced. So at that time, I had a bridge put in. I didn't know much about implants at the time. And I was just wondering, if eventually the bridge gives out, could I still have an implant?
The answer simply is yes, of course. Oh. And this is one of the limitations that we have. And bridge work used to be the standard of care when implants were not as successful and predictable as they are today. So we can't fault the dentists from before for doing that type of work. However, today we would argue that when a tooth does fracture, and it's fractured in a way that can't be repaired, when it comes out, we immediately put an implant in, and the reason is the bridge will fail eventually, just as you've noted, and we can prevent all of that, of course, by putting the implant in first, but we can build it later.
Oh, okay then. And by the way, I like a good cup of coffee too.
Well, listen, you know where to get it. If you're in Vancouver?
Yeah.
It's the address 777 West Broadway.
That's correct.
At Willow.
At Willow and Broadway, and it's Suite 501.
So listen, Lance, just tell them that you're a friend of Tom's on the radio, and Dr. Ron Zokol. And first of all, you've just come by to have a cup of coffee and look at the view, and maybe have a chat with the dentist. What do you think?
Yeah, that sounds like a good idea.
Yeah, a free consultation for you.
Yeah.
It's free, and so is the coffee. Lance, thank you for taking time to call us this morning. Appreciate your company.
Yeah, no problem.
Thank you very much.
Thanks, Lance.
Anybody else want to talk to the good doctor? 604-280-0650 is our telephone number locally, 604-280-0650. Out of the local dialing area. If it's a long-distance call, maybe you're on the island or Fraser Valley, or maybe in Washington State even.
Why not?
Give us a call, toll free. We'll pay for it. And that number is 1-877-280-0650, 1-877-280-0650. When you were speaking with Lance, you were talking about implants, and you said they haven't been around forever and a day. How long have implants been around?
No, they haven't been predictable forever and a day.
Oh, predictable. Oh.
Now, if we go back, I recall seeing a picture of an implant that was put in, and they estimated the time that was put in was 7,500 BC.
What?
Yes. Yeah.
No.
When in teaching this field, I've often referred to this profession as the second oldest in the world.
And we all know what the first one is, right? Radio announcer.
But implants have been around forever. I mean, people have been sticking coral. They would shape coral and pound it into the area of a missing tooth way back before the birth of Christ.
Wow.
And yeah, really. And it was only actually in the 50s and 60s that the work of P.I. Brannemark in Sweden, actually, as an orthopedic surgeon, found the relationship of titanium to bone that makes implant predictability so good today.
So modern day predictability began in the 1950s?
Yes. Well, he did his research there, but he withheld it for about 15 years before he presented it to the dental community. I don't know why. But from there on, it just was an incredible leap forward in the amount of work that we're able to do. We were able to treat people more comprehensively and more completely, return them to their natural health level as close to having natural teeth as we have ever been able to do because of this technology.
I know why that doctor years ago didn't tell everybody right away, because he was waiting for you to come along and explain it in plain old everyday English to people. That's why. That's another thing I like, too, about your offices. You go there, the doctors will talk to you. They'll look at your teeth. They'll take pictures, x-rays. They'll work out a system, a plan. But you will explain to the people in plain English what you're going to do and why it should be done.
Yes, and we'll give them the options. We aren't there to dictate needs or anything else. We want to help and give you what you're looking for, solutions that will be valuable to you. And part of it starts with health, and the other part ends with reconstruction, rebuilding.
And I know for a fact, too, that you'll also tell people if they don't need treatment.
Oh, absolutely.
Yeah.
Yeah, absolutely. We aren't there to fabricate work. There's lots of it. What we want to do is make sure, from a long-term basis, if we help people become better and we do it in such a way that it doesn't hurt them, cost them too much, they're going to help other people by referring back to us.
And word of mouth advertising in your business is very important.
It's a mouth relationship.
It's
yes.
a mouth relationship. You're naughty. I think we have another call on the phone, do we? Good morning. How are you?
I'm fine, thank you.
Welcome to the show. What's your first name?
It's Nargis.
Nargis, welcome. You're in Burnaby?
Yes.
And would you like to talk to Dr. Ron Zokol?
I do. I have a question for him.
Go ahead, Nargis.
I'm interested in having teeth in a day, but the only thing that worries me is that it takes about 6 months to heal. Is that right? And you can't eat any solid food?
Not true.
Not true?
Not true.
Oh. So you can eat right away?
You can, but we're going to encourage you to keep your diet down. And we're not talking 6 months either. We're talking a very short period of time. You can still eat. And because when you put in teeth in a day, you're putting all your teeth on a total of 4 to 6 implants, depending if it's an upper or lower jaw and how much bone you have. But you will be able to eat on those teeth.
Oh, okay. Solid food too?
Yes, ma'am.
Wow, okay, I'll be there.
We'd like to keep you away from the oyster shells and things like that, but by and large, the majority of foods you can eat. We just caution you to be as careful as possible. But you got to smile with. They don't move, and you can eat most foods.
I tell you what we're going to do right now before you go, and while we have Dr. Ron Zokol here, let's just go down the list. What foods were you considering? And we'll say yes, eat it, no, don't. How's that?
Like apples.
Apples?
Yes.
Yes, apples are good.
Well, soft meat, not hard meat.
Yes.
Oh, okay, that's good.
Ice cream? Milkshakes?
I try to keep away.
Good for you. Now, you live in Burnaby, so if you wanted to go by the office, there's one in Vancouver for you, and we'll give the telephone numbers on the website for you in just a second.
I do have it.
Well, good. Yeah, well, give them a call. It's painless, and it's a free consultation.
Great. Okay, I will.
And thank you for listening, and thanks for calling in this morning. We appreciate your company.
You're welcome.
BC Perio Dental Health and Implant Center.
That's it.
Pretty new place down there on Broadway.
Yep.
777 West Broadway, and your location on Johnston Street in Coquitlam, too?
Yes, it's right in that little mall that's just off of Johnston Street by Glen.
So do you and the doctors sort of rotate between the two offices?
We do. There's 3 of us that rotate through the Coquitlam office.
Nice.
And it's Dr. Birdie, Dr. Munns, and myself.
Okay. And if somebody would like to give you a call in the Vancouver office, 604-259-1108, 604-259-1108. And in Coquitlam, it's 778-653-9157, 778-653-9157. This is Boomer Life on AM 650 Radio. We're speaking to Dr. Ron Zokol, who is well known in this city for his work and also his radio work. And Dr. Bobby Birdie is nowhere to be seen today.
He's helping his family today.
Okay,
It's
so
family
we're
time.
all right. And I promised we wouldn't take the mickey out of him too much, but maybe just a little bit, huh?
I'll go with you on that.
All right, we got more coming right up right after this.
It's all about the baby boomer lifestyle. Boomer Life on AM 650.
What is integrative healing? It's when multiple practices and naturopathic medical philosophies come together for the common good, your health. Since 1984, the 3 founding doctors at Integrative Naturopathic Medical Center have built their practices on the combination of modern science and traditional medicines. They believe inner health and outer beauty go hand in hand. It's this integrative approach that leads to a customized health solution, a personal plan based on your specific needs to assist in looking and feeling better. Nutrition and weight loss, pain and inflammation management, injury medicine and healthy aging, acupuncture and massage therapy, naturopathy and chiropractic service. To learn more about Integrative Naturopathic Medical Center and their wide range of integrative health options, visit integrative.ca. That's integrative.ca or call 604-738-1012. 604-738-1012.
They say there's no place like home, and isn't that the truth? In fact, that's what Shannon Oaks is all about. It's a place that's built on more than a welcome mat. It's built with love. Shannon Oaks is an all-inclusive, premier independent retirement living home. They realize that you don't need care, but maybe some support might be nice. It's still completely independent, just like you're living now. Open to singles and couples. Part of Baptist Housing. Book your tour today. Learn more online at baptisthousing.org.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
Missing teeth? Tired of your dentures? Not sure which dental solution is right for you? Dr. Bobby Birdie can help. A certified specialist in periodontics and prosthodontics, Dr. Bobby Birdie can show you your options and assist in determining if dental implants, teeth in one day, or implant-supported dentures are right for you. Book your free consultation at bcperio.ca. That's bcperio.ca. Find your dental solution with Dr. Bobby Birdie and Dr. Ron Zokol. bcperio.ca.
AM 650. Chew it, 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 baby. Every time you love me, it's a real sugar treat. Chew it, 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 baby. Love me, little chew it.
Very cute.
Do it so
Like that, huh?
Very cute.
I made the dentist smile, friends. Okay. Chewy, chewy, chewy. The Ohio Express. You were probably about 17 when that song was out.
I'm not even telling.
I know when that song was out, and I got a rough idea how old you are, too. I think you were just moving and grooving at the high school hop to that one.
Yep.
That's probably what gave you the idea to become a dentist, right? You heard that song, Chewy, Chewy, Chewy. No. Your dad was a dentist.
He was. Yeah.
Yeah. You learned from your dad.
I learned
Well,
a
not
lot
everything,
of
of
things.
course.
Well, no, but he was a great mentor.
And what kind of dentist was he?
was
Besides being a good one.
He was a prosthodontist.
What does a prosthodontist do?
A prosthodontist is a specialist in the dental field who provides a refined or higher level quality of work when it comes to building the teeth themselves. A periodontist, for example, works with gums and bone structure and things like that. But a prosthodontist doesn't do a lot of surgery. They do the structural reconstruction of teeth on top of implants or the reconstruction on natural teeth.
Interesting. Our telephone number, by the way, we had some people call in. If you have any questions for Dr. Ron Zokol, please feel free to call. It is a free call. The advice is free, just like at the clinic. And the telephone number is 604-280-0650, 604-280-0650. And if it's a long-distance call, teeth are teeth, no matter where they are, right? 1-877-280-0650, 1-877-280-0650. That's a toll-free call. We'll pay for it. And in town, 604-280-0650. You have two convenient locations. People can stop by and see you on West Broadway at Willow Street.
Yes, 777 West Broadway.
And, of course, in Coquitlam, 1175 Johnson Street.
That's correct.
So whereabouts in Coquitlam would that be?
That's not far from the Coquitlam Center.
Okay.
It's very close. It's Johnson and Glen.
Good. And what sort of hours do you keep?
I think it's open pretty much Monday through Thursday, if I'm not mistaken. I'm generally there Thursdays.
Thursday's your day?
Is my day.
That's the day I'm coming.
All right.
Yeah. Because you got to feel comfortable when you go to see the dentist.
Absolutely.
You and I have talked about this before. Like, I love going to the dentist. Well, I don't love it, but I mean, I don't mind going to the dentist. It's physicians if they had said, Tom, we want you to do a show with the body doctors, I'd forget it. Because I feel like they're looking at you. Right?
Yes.
But being with Dr. Ron Zokol is very comforting. It's very soothing.
Thank you.
It's the way we feel when we come out of your office. Comforting, soothing, and new teeth.
Absolutely.
And for me to come and see you and have you look at my mouth and climb in there and look around, it's not going to cost me anything, eh?
That's what we do.
That's what I like to hear. Hey, we've got Steve on the line. Doctor, you are popular. We're going to talk to Steve, then we're going to talk to Larry. So let's say good morning, Steve. How are you?
Oh, hi.
Hi, Steve.
Welcome to the show, Steve. How are you?
Hi. Okay, carrying on. I had a question here. How do you know that you need a sinus lift?
Well, it's hard for you to know, but the probability is that if you have an upper back tooth where you want to put an implant, you have to be suspicious that there's very, very high probability that you'll need a sinus lift. And there's depending if you're one of those individuals where the sinus doesn't drop down, and we have them, then we can fill that area without a sinus graft. But most people who have been missing a tooth for a little bit of time, a significant period of time, usually needs a little bit of help with the sinus elevation.
Oh, okay. So what's the procedure to do a sinus lift?
Depends on how much it has to be lifted, actually. See, we have solutions. If there's a certain amount of bone available to us, we can put shorter implants in, or we can go through we make a entry into the jawbone. We can actually push the sinus up very slightly, and that's a very easy procedure to do, and put the implant in at the same time. Or we can go from the side and elevate that whole area up. That sounds a little bit gruesome, I suspect, but it's very straightforward for us.
Oh, could it be done just within like one treatment, or?
Sometimes it can, but everybody's an individual, and everybody has to be evaluated as to their specific need.
So how would one find out if I guess through an X-ray or?
It's a perfect question. And what you do is you come in for a visit. We will take a complimentary scan to evaluate how much bone structure you have and tell you exactly what you're going to need in order to do the case really well and properly. It's going to last you a long time.
Is this an X-ray which they call it 3D or?
Yes, it is a 3D X-ray. It's exactly right.
Oh, okay.
Now, Steve, before you go, my wife is a patient down there at BC Perio. She went in. She had to have the nasal lift, sinus lift.
That's right.
And the bone thing, whatever that is.
That's right.
You mentioned that before.
That's right.
And Steve, I just wanted you to know that she came out of there. She was smiling. She felt no pain.
And that's common.
That's common.
Yes.
So,
okay.
Steve, are you nervous at the dentist?
Yes, I am.
Well, you know what? Don't be.
We specialize in people who are nervous.
Oh, okay. Because what's happened is I had a root canal done many years ago, and then the tooth was extracted.
Yes.
And I've had this ongoing severe pain, and also had sinus problems. So I'm just wondering if this, if there's any sinus lift required, or what. I want to, of course. I've got a big hole there now.
Steve, are you still in pain?
Sorry, yes, I am.
Okay, that's first and foremost what has to be taken care of. We got to get you out of pain.
Right.
And once we get you out of pain, we can figure out what's the best route to rebuild your missing teeth.
So
but the first step is the pain.
Right. So I've had sinus surgeries,
Mm-hmm.
but the problems are still carrying on. The sinus problems, I think, are still there. So I'm wondering if the sinus lift might help me in any way.
Not for what you're looking for. You have to find the source and the reason the pain is there. And it's usually not because of the sinus position, but it may be because of the back teeth in your upper jaw. That may be a contributing factor to your ongoing sinus problems.
But all this started after the root canal.
But that's a time issue, Steve. And we appreciate that you recognize the relationship of when it started as to when you lost that tooth. And it may have a contributing factor, but the ongoing pain you're having is likely related to something else, and we got to figure that one out.
Because I've had a dentist look at the back teeth; they're fine. But I know one. It was mentioned to me before that sometimes when the tooth is pulled, you can have the bone. There can be a problem with the bone, and then you have to do something like the sinus lift or something like that.
It's unrelated to the pain you're feeling right now.
I have a severe ongoing pain.
The first step is figure out where it's coming from, then correct it.
Okay.
So you can take care of his pain?
Well, very quickly you can prove it an anesthetic takes care of the pain, but that's not long term.
Mm-hmm.
That wears off. And then you still got it. So you still have to figure out where the pain's coming from. And that's how you stop it.
Tell you what you do, Steve. If you're not satisfied with the help and the treatment you're getting elsewhere, go and see Dr. Ron Zokol or Bobby Birdie. Do me a favor. The consultation is free. If you go down there, don't let the dentist know, but call me and let me know how they treated you. Would you do that?
Sure, I will.
That a good boy. So we'll give you your telephone. We'll give the doctor's telephone number in just a few minutes. So keep your radio on, okay?
Okay.
Yeah. Good luck.
Good luck, Steve. Thank you for your call. I appreciate you sharing the story.
Thank you.
All right. It's 11:47. That's the time. It's radio. No, it's not Radio Real Estate. That was the radio before this. It's Boomer Life with Dr. Ron Zokol. Hey, you're not related to that guy that does the exercises. That's Zokol, are you?
That's Zokol.
Oh, Zokol. Sorry.
I had patients come out and say, "You set up a physical fitness program?" I said, "Excuse me."
Well, maybe it's those rubber mats you have there in the waiting office. Larry, good morning. Welcome to the program.
Hello there.
Nice to have you on the show.
Hi,
how
Larry.
are you?
Hi. Sorry, what'd you say?
I was just asking how you were, but apparently you must have something going on in your mouth you wanted to talk about.
Okay. Actually, I was kind of wondering. I've been told that I had a root canal done a while ago, and at the time I couldn't afford the crown, so I just had it filled normally or whatever, and I gather it cracked, and now they put a band around it, and now they're saying that you should really get the crown, but I'm just kind of wondering, is there any, have they come up with anything different other than gold crowns and things like that?
Are you looking for something inexpensive?
Yes, in a way.
Yes, I think I understand what you mean. When you think about what you're looking for, you're trying to hold that tooth together physically, structurally, really strong so whatever fracture potential doesn't propagate so you lose the tooth. It's really unfortunate, but there's not a lot that you can do and rely on. Everything that we have that's going to help that tooth become that much stronger is a little bit on the expensive side.
Okay.
So you can't put a filling in there and expect that you're going to get the results of, let's say, putting a crown on the tooth.
Okay. And if you have already got like back teeth removed that were beside it or whatever, then I guess if you were to take that one out, there's more tendency to fall over then, is there?
Well, falling over is probably a small part of the issue. What really happens is that when you lose teeth and particularly your back teeth, the other teeth never intended to take the full biting force that you generate, and so you put a lot more pressure on your smaller teeth. That's why you're cracking and breaking those smaller teeth. As difficult as it is to imagine, and particularly with the cost of doing something, if you would like to keep your teeth and keep them stable, then you got to replace those back teeth to distribute the force better. And I know you probably didn't want to hear that, but that's the reality. And if everything's coming apart to the point where it's just going to be a massive cost with very, very poor future results, your best option might be implant-supported teeth, because they don't decay and implants don't break as a rule, and it can provide you probably with a lot more satisfaction over a long period of time.
Okay, and so in other words, if I don't have implants today, and I'm not really sure if I need implants, I could actually come out to your Coquitlam branch and get a free estimation or whatever?
Yes, you can. You can come in. We can do an evaluation for you, a complimentary evaluation, and we can guide you as to the direction we think is in your best interest. And we invite you to do that. There's no absolute requirement to come over and complete the work. We will help you understand a little bit more about your mouth and what there is available in the science of dentistry and dental health sciences to give you what you're looking for.
Okay. Sorry, and what's the name of the company again?
BC Perio. And
BC
the
Perio.
website is www.bcperio.ca.
Okay, well, thank you very much for your time.
And before you go, if you go to the doctor's website, there is a link there. I forget the name of the company, but if you in need of financial assistance, they can help too.
Okay.
Yeah, and it's very reasonable too. And I've talked to the people, and they'll be glad to help you out. So go see Dr. Birdie or Dr. Zokol, and they'll tell you what you need. Okay.
Okay, thank you very much.
Thank you for your call. I appreciate your time this morning. And we have a little bit of time left on the show. Our telephone number is 604-280-0650, 604-280-0650. And if it's a long-distance call, it's 1-877-280-0650. That's 1-877-280-0650, toll-free number in Metro Vancouver, 604-280-0650. Before we go to break, Dr. Ronnie, I've got a little song for you because I know you like to make people happy, right?
I do.
Listen carefully to this one here.
AM 650. Oh, happy day.
This is a good song, eh?
It's a great song.
Oh, happy day. I feel so happy. I went to see Dr. Zokol. I went to see Dr. Birdie. I'm a happy man, yes. Look at my beautiful teeth.
It's like snake oil sales here.
Well, not quite, just about. It's 11:52. You've got the Radio Real Estate Show. It's I keep saying that. I'm so sorry. It's Boomer Life, and I know you're going to pull a tooth when I finish here, aren't you? Without any anesthetic, right? I'll teach that kid. Yes, okay. BC Perio is the name of the actually it's BC Perio Dental Health and Implant Center.
That's correct.
2 locations, West Broadway and in Coquitlam.
It is.
Okay. And our telephone number, 604-280-0650, 604-280-0650. Toll free, 1-877-280-0650. We got more on Boomer Life coming right up.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on AM 650.
Missing teeth? Don't want dentures anymore? Not happy with the way your smile looks? Dr. Ron Zokol can help. As an internationally recognized authority in oral implantology, Dr. Zokol is dedicated to all your dental care needs and can help solve your dental problems and help you achieve optimum oral health. Book your free consultation or learn more at drzokol.com. That's DRZOKOL.com.
They say there's no place like home, and isn't that the truth? In fact, that's what Shannon Oaks is all about. It's a place that's built on more than a welcome mat. It's built with love. Shannon Oaks is an all-inclusive, premier independent retirement living home. They realize that you don't need care, but maybe some support might be nice. It's still completely independent, just like you're living now. Open to singles and couples. Part of Baptist Housing. Book your tour today. Learn more online at baptisthousing.org.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
AM 650.
When you worry, your face will frown, and that will bring everybody down. So don't worry, be happy. Don't worry, be happy now.
Don't worry, be happy, man. So that's kind of sums it up for your office. People are kind of worried when they go in there, but they come out and they're happy.
That's what we try to do.
Teeth in less than an hour.
And that's possible, too.
It is possible.
Yes.
That's amazing.
Yes.
We're talking about dental implants and dental problems and solutions to dental problems. And do we have a caller on the phone? Hello? Do we have a caller on the phone? No, we don't. I see the phone lit up, but maybe they're just calling for pizza. I don't know. So you have 2 convenient locations, one in Vancouver.
One in Vancouver, 777 West Broadway.
And the other one?
And 1175 Johnson Street in Coquitlam.
And the website is bcperio.com.
Correct. No, .ca.
.ca, I'm sorry, bcperio.ca. It's important you make it .ca and not .com because God knows where you'll be taken off
I
to.
believe it's Texas you go to.
Is it really? Oh, that's nice. bcperio.ca. Our telephone number is 604-280-0650, 604-280-0650. In the remaining few minutes that we have, if you would like to speak with Dr. Ron Zokol, he'll be happy to have a chat with you. It's amazing the work that you guys are doing down there, a brand new location. People come in, they have problems in their mouth, you find solutions for them.
We do. We do. It's specialty level work, and what we do is provide our experience and knowledge, and we help people get healthy and rebuild those things that are important for them, their smile, their self-confidence, all the factors that come along with regaining what your natural teeth originally had for you.
Then you can go out and eat corn on the cob.
You can.
What about age group? Is there any age restrictions?
Yeah, the young people. Young people up, when they haven't finished growing, that's the problem. The other age restrictions you might think of is the elderly people, but not so much. What we want, all we have to make sure is they're healthy and stable, because even if you're in your 90s and you're healthy and you can heal properly, you can have dental implants placed in.
Well, you know what? I mean, I could be in my 90s. I have like really bad teeth. I go see you guys. You fix me up. I go on a cruise, meet somebody interesting. Only because I have nice looking teeth,
That's right? And we did this for a gentleman who was in an old age home.
Really?
But he found a lot of companionship in the old age home.
I bet you he did, too. Here's got my teeth. Is Larry still on the phone from Surrey? Larry, line 1. Good morning. Hello? Apparently not. Is there somebody on the other line? See, we have somebody who's working the phones that's deaf. Just kidding. 604-280-0650, 604-280-0650. We have a couple of minutes left of the program. If you have a question for Dr. Ron Zokol, or 1-877-280-0650. The website is bcperio.ca. bcperio.ca. BC Perio Dental Health and Implant Center is the location. And West Broadway, 777 West Broadway, or in Coquitlam. So, yeah, if you have any concerns, you're the guys to go and see.
You know, I think one of the things that we do enjoy, we all feed off each other. With each one of these people has a massive amount of experience and knowledge, and it's really, really working out well.
All right. So, again, can we give your telephone numbers at the office? I have them handy if you don't know them off by heart, because this is a... You want me to do it?
Please do.
Okay, because that's what I'm paid for. The number in Vancouver, 604-259-1108. Repeat after me, 604.
604.
Nice. 259.
259.
11.
11.
0.
8. Thank you very much.
Okay. See, and we say 0 because 0 is a number, O is a letter.
Correct.
All right. One more phone call. We have time for one more phone call. Do we? Yes, we do. One. We have two producers in the studio. One guy says yes. One guy says no. I went to a couple of doctors like that one time, and guess what?
You didn't get anything done.
I never got anything done. It made me feel good.
That's what they say about a man with one watch knows what time it is, and a man with two watches never certain.
And in Coquitlam, the telephone number is 778-653-9157, 778-653-9157. You taking the rest of the day off?
Absolutely.
Well, you've worked hard enough today.
I've had a long week.
BC Perio Dental Health and Implant Center, Broadway in Vancouver, Coquitlam.
Yep, it's 1175 Johnson Street.
By the Coquitlam Center?
By Coquitlam Center, yeah.
Fantastic. And the telephone numbers again in Vancouver, 604-259-1108. In Coquitlam, 778-653-9157. You can get those numbers off the website. Dr. Ron Zokol, thank you so much for coming in again today.
An absolute pleasure, Tom.
I always have fun when I talk to you. I just go smiling and feeling good.
Yep.
So if you wanted some dental solutions, consultations, how much?
Nothing.
Free.
For consultation. Absolutely. It's
All right.
complimentary.
It's a good place to leave it. Get people thinking about it. Free consultations, folks. Go down and check them out. Give me a call. Let me know how they treat you. We're back. I'm back. Well, you're back probably next month with more of this great stuff.
Yes, sir.
And I'm back Monday afternoon with some music for you.
Look forward to hearing
So
it.
while you're drilling, you'll tune in. Enjoy your weekend. On behalf of Dr. Ron Zokol and Greg, it's Tom saying thank you. Bye.
The proceeding was a special advertising feature on AM 650.
What is integrative healing? It's when multiple practices and naturopathic medical philosophies come together for the common good, your health. Since 1984, the three founding doctors at Integrative Naturopathic Medical Center have built their practices on the combination of modern science and traditional medicines. They believe inner health and outer beauty go hand in hand. It's this integrative approach that leads to a customized health solution, a personal plan based on your specific needs to assist in looking and feeling better. Nutrition and weight loss, pain and inflammation management, injury medicine and healthy aging, acupuncture and massage therapy, naturopathy and chiropractic service. To learn more about Integrative Naturopathic Medical Center and their wide range of integrative health options, visit integrative.ca. That's integrative.ca or call 604-738-1012. 604-738-1012.
Missing teeth? Tired of your dentures? Not sure which dental solution is right for you? Dr. Bobby Birdie can help. A certified specialist in periodontics and prosthodontics, Dr. Bobby Birdie can show you your options and assist in determining if dental implants, teeth in one day, or implant-supported dentures are right for you. Book your free consultation at bcperio.ca. That's bcperio.ca. Find your dental solution with Dr. Bobby Birdie and Dr. Ron Zokol. bcperio.ca.
They say there's no place like home, and isn't that the truth? In fact, that's what Shannon Oaks is all about. It's a place that's built on more than a welcome mat. It's built with love. Shannon Oaks is an all-inclusive, premier independent retirement living home. They realize that you don't need care, but maybe some support might be nice. It's still completely independent, just like you're living now. Open to singles and couples. Part of Baptist Housing. Book your tour today. Learn more online at baptisthousing.org.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.